call from my sister. Hey Gemini, I have it. I was like, have what? And my heart sunk. I remembered the news I have been watching. I remember the statistics, the thousands of people who have died. I remember the numbers. This thing wasn't just what I hear in the news. Now it has come. Good morning, or good afternoon, good evening, wherever you are. This is Style by EJ, and today's video is going to be totally different from what I'm usually known to do on my channel. My channel is all about fashion, beauty, lifestyle, but this is more like a lifestyle video because what is actually happening right now is a switch in our norm and our lifestyle that we're used to. This is a new normal, and the earlier we get used to it, or the earlier we understand that this is how our life's going to be, the better for us. So I have been following the news very closely, following the stock market, following the health sector, following everything that has been happening, and it's a little bit disheartening what people are going through, what the world is going through. There are helpless people all around, and I don't know, it's really disturbing, and I just want to send my love and light out to anyone who is at this point in time not knowing what tomorrow holds and not knowing what the next second holds. Okay, so we have our first responders. These are our modern day heroes. Heroes don't always have to have capes and don't always have to have, you know, a placard and all of that, but we have heroes that go out each day to save lives. We have heroes that go out each day to ensure that the supply chain is seamless. We have heroes all around us. And I'm privileged today to have two of our heroes. They're both in the health sector. They're going to talk to us about what's going on and their personal experiences. And I hope you do enjoy this video. Alright, so if you want to know more about the conversation, it's a very, very captivating one. I would like you to stick around.
My name is Ose Ikem. I'm a clinical pharmacist with one of the top healthcare systems here in the United States. As a clinical pharmacist, we respond. I'm part of a team of dynamic group of healthcare professionals. Our goal right now is to provide top quality care to the general population who have contracted this highly transmittable disease and who may be symptomatic or asymptomatic, meaning that they may show symptoms or they may not show the symptoms, and those who need critical care. As part of the management team for the patients needing hospital care, we may require to verify and provide medication for these patients. We make sure that the intravenous drips, the antibiotics, if we need to sedate patients or intubate patients, the medications that are required get to the physician on time and in a safe manner.
Hello, my name is Mrs. Izahia Ramaselli. I'm a family nurse practitioner practicing here in Brooklyn, New York. What exactly does a family nurse practitioner do? So a family nurse practitioner takes care of patients just like your primary care provider would. We assess, we diagnose, and we make a plan of care for a patient, as well as we prescribe medicine. So where do I work? I work in a long-term care facility, which is actually a facility that houses a lot of elderly and sick people. And usually they have a lot of comorbidities, which has to do with chronic conditions, be it congestive heart failure, COPD, hypertension, diabetes, asthma, and as we all know, maybe we don't know, these comorbidities actually affect their health, especially in this time of bugs going around. We did have a couple of deaths, actually a lot of deaths due to the bug going around. What's a very, very sad situation.
I'm not in the health sector, I'm not in the supply chain where I go out daily to ensure these things, you know, humanity is being taken care of. But from my own point of view, okay, I'm a content creator. I have my 9 to 5, and thankfully, I would say I'm grateful to God that I'm able to work from home. Okay, but then again, this affects me so much because I'm indoors. I can't go out freely. You know what happens when your freedom is taken off of you? That's exactly how my mental space is right now. Like, I cannot go out because I don't want to get sick. I don't want to get, affected. So it's a little bit disturbing. And then the most disturbing of all is knowing that I have family, siblings who are in the health sector, who go out every day. When I look at the statistics of the world, when I look at New York, for example, we know the numbers out there. And guess what? I have a sister who is a nurse practitioner who goes out every day and she still has to take care of a patient. I have a sister who is a pharmacist down here down in Texas, who has to go to work every day. Let's hear from them and let's hear how it has been.
Given the situation going on around the country, actually around the world right now, and how does it affect my practice as a nurse practitioner? I would say it's been very challenging, being that, like you all know, we are essential workers. So we are in the front line of this bug that is going around. As you see on TV, I'm sure you need to put on your PPE, which is your personal protective equipment, just so that you don't catch the bug. How does it affect me as a person? I would say it makes me acknowledge and to realize how lucky we are to be in the service industry. We are able to help people that are in need, especially. But then again, it also challenges us because we come from families. Some of us are married, some of us, have kids.
I wanted to be a pharmacist so I could help people. So this just kind of reiterates our unique position. We are all at the background, making sure that those medications get to the patients on time, get to patients safely. We research and look for clinical trials that will show potential for any therapy and make recommendations to physicians. So pharmacists are strategically positioned to be part of the healthcare team, and in collaborating with the physicians, they provide top quality care to the patients.
So one day I was home. I think I was driving out, or I was on my bed, I don't remember, and I got a call from my sister. My sister and I, we talk a lot, like we could be on the phone for hours. So I got a call from my sister. Normally she makes jokes, normally she just says things like, oh, what's up, and all that stuff. And then she told me, hey Jemma, I have it. I was like, have what? I have it, I have this bug. I am infected. I was like, why are you joking? You kind of joke like that now. But then again, my sister is not one to make light serious issues. And then she said, yes, I got it. At that point in time, my heart sunk.
It was just an ordinary day. I went to work, I remember clearly, came back from work on that day, on a Friday. I felt great all day. But when I got home, I just knew something was wrong. And I told my husband that, I don't feel well. I just took Tylenol and I went to bed. But I woke up with chills and rigors, and it felt like I was shaking and I couldn't control my fever. I had elevated temperature. I took my temperature at night, and it was as high as 103 Fahrenheit. I'm not exactly sure how that converts. But I took Tylenol and I took a warm bath. I went back to bed sometime about 1 a.m. at night, only to wake up again about 5 o'clock with chills and rigor. It was a very scary, very scary situation because you're doing all you can to control your temperature, but it's not coming down.
You call with her when she told me she looked pale. You could tell that she was in pain. You could tell that I had to remain strong for her. Each time I get off the phone, it puts me in a moment of sadness. I prayed for her tirelessly. I will call her and say, how are you today? I used to call her morning and night. We'll be on the call for hours. I would ask her, how are you today? She says, oh, I'm good, but my temperature is still high. Guys, her temperature went up to 103 degrees. She will tell you, oh, my temperature is still high. And she still remains strong, like, because she's a nurse, of course, she knew what to say.
Exactly what's going on because you've been exposed to these patients in the facility. So what did I do? I tried to do the home remedies, knowing fully well that there's really no cure. There's no cure for this bug. I did the home remedies. I drank lots of water, lots of lemon, ginger, lime. I boiled it all together and drank it. I took lots of oranges, vitamin C, because oranges gives vitamin C, and that helped me somewhat. What other symptoms did I have? I had a lot of body pain, body aches and pains, especially in my joints. It seemed like someone just took a whip or a lash or a hammer and just, pounded me with it. And to tell you the truth, it's been about 3-4 weeks now, and I still have those pains. What other symptom did I have? The inability to smell was there. I'm very slowly recovering from that, but my sense of smell is not as sharp as it used to be. I'm able to smell, but not like it used to be, I'm hopeful that I'm able to overcome that.
They had sent a mail that she needed to go to work. I was like, no, you are not going anywhere. And no, you cannot go to work. Like, at this point, my heart was beating. I was panicking. Like, you have not fully recovered and you're being asked to come back to work. My heart was beating. I was scared. She said, Ejima, don't worry, I'm fine. I know you're worried for me. I am fine. I am fine.
I'm back to work now, taking care of patients. That's our calling, right? That's what we signed up to do. And we really, I'm sure you guys probably are wondering, how come they go back? I couldn't do stuff like that. But yeah, it's a calling, and you feel like you are part of a team and that you need to be there for these patients. And that's what actually keeps you going. The fact that people do actually recover and they get better and you see them do well, it gives you a sense of joy. It gives you a sense of satisfaction. It gives you a sense of appreciation for being helpful or being instrumental to their wellness.
Going to work each day, of course, we were able to identify the patients that have caught the bug, and I passionately follow them. I follow their progress. When we need, there are times when they are crashing, they are saying this patient in this room is crashing. I'm it emotionally affects me because I'm just rooting for them. I'm rooting for them and hoping they make it. When we need to make out those vasopressors, when we need to, to resuscitate them, I am rooting for them. So, from a pharmacist going to work point of view, I follow them and I just root for them and hope they get better. But personally, in my personal life, my sister who lives in New York, she did get it, and it was really a very trying time for us, a trying 3 weeks. It was tough, but she fought it. It's not a joke. It's surprising, or I just realized that I could have just lost her just like that. So you know, this is a real pain. We also have a family friend up in the Northeast who you know, who struggled for his life with this bug. So it is real. It affects families, and people lose multiple members of their families just like that. So I am blessed to have my loved ones still with me. They overcame this this bug, but it is real.